Well, hey guys, I hope everybody had a wonderful Thanksgiving yesterday here in the United States, and welcome back to the Q&A. Today I'm going to be addressing many questions that you all have regarding the condition keratosis pilaris, which is a type of dry skin condition. And this is sort of a follow-up to last week's Q&A on tips and tricks and questions about moisturizing the body. But today's Q&A will be specifically addressing your questions about the condition keratosis pilaris. And this is sort of a follow-up to an old video that I did many months ago on kind of dermatologist tips for keratosis pilaris that was very, very short and generated a lot of questions. So I wanted to come back to this topic because I know many of you suffer from this skin condition and many of you have family members who are plagued by this skin condition. And this time of year when the ambient humidity drops and the air becomes drier, it becomes colder, keratosis pilaris can really become very problematic and far more noticeable. So I thought today's video would be in keeping with the season, if you will. And if you're new here, welcome. My name is Andrea. I'm a dermatologist and I post fun day in my life type vlogs where I share a lot of fun lifestyle and recipe type content, as well as sit down skincare Q&As where I talk about a skincare topic that is of interest on my channel in terms of the comments that I get. And I also post skincare product reviews and talk about the salient features of different skincare products as far as their ingredients and what ingredients to look for. So if this type of content is of interest to you, I encourage you to stick around. If you're not familiar with keratosis pilaris, it's a dry skin condition in which skin around the hair follicle, or little openings where our hair comes out on the face and the body, can develop just an excess amount of dry skin that builds up into these little, what are called little keratotic mounds that result in the appearance to the eye of a kind of rough, scaly, sandpapery type bump, often on a red base, okay? This most often can occur on the face, as well as the upper arms and upper thighs, okay? And it is a chronic skin condition, and it has a tendency to occur in people who are overall plagued by dry skin. It affects up to half of all normal children and is very uncommon in older adults. So it does kind of tend to, I guess, die down a little bit into the elderly years, but it affects many children and adolescents and adults as well. And it's due to the abnormal buildup, essentially, of dry skin around the opening of the hair follicle. And it sort of results in a little thick, scaly plug within the hair follicle. And that little plug does not exfoliate properly as the normal skin turnover occurs. So it needs a little bit of help being dislodged. And it appears as though the tendency to develop keratosis pilaris is somewhat rooted in a genetic basis, in that individuals with a family history of either keratosis pilaris, atopic dermatitis, eczema, dry skin, or itchy skin tend to be plagued by this more readily than those with unaffected family members. Keratosis pilaris type rashes can occur in patients undergoing chemotherapy with a drug called vemurafenib, as well as some other targeted cancer chemotherapies. And as I said, it tends to appear on the face, the sides of the arms, the thighs. It can also appear on the buttocks as well. It tends to be symmetric, okay? In other words, it doesn't just affect one arm, it tends to affect both, or it doesn't affect one side of the face, it affects both. Keeping with the time of the year in particular, it tends to be most problematic and most noticeable when the humidity drops. So in drier climates and during the winter months when the heater is on and the humidity in our home starts dropping, keratosis pilaris is really prone to flaring. And it's very important for everyone to understand that this is a chronic skin condition that is likely going to plague the individual throughout their adult life, potentially burning out a little bit into their elderly years. This skin condition can have profound effects on an individual's self-esteem. Many people state that they feel embarrassed by their keratosis keratosis pilaris. They avoid social situations because of the way their skin looks. So you can see how this skin condition has profound effects on an individual's overall well-being, okay? Dishearteningly so, individuals with keratosis pilaris are unfortunately often teased for their skin condition. I believe that it stems from ignorance on the part of the bully. My heart goes out to you if you suffer from this condition. And no, it's not okay to be bullied for a skin condition such as keratosis pilaris. And if you are suffering from keratosis pilaris, or you know someone who is, you are feeling really down about yourself and it's impacting your self-esteem, your ability to go out and interact with your peers, I encourage you to talk to someone such as a mental health professional. I will list down in the description box below a resource that I am rather fond of called BetterHelp that provides accessible online counseling. And I think it is a great place to start if you need to talk to somebody. So unfortunately, there is no cure for keratosis pilaris. However, it is essential that the individual develop a consistent skincare routine to manage the keratosis pilaris and reduce the number and severity of flares of keratosis pilaris. The first thing that you should know is that soaps can worsen the skin condition because soaps are detergents that dissolve the top layer of our skin and dissolve the lipid component of our skin. This disruption in the skin barrier results in what I talked about last week, increased transepidermal water loss. And as water is lost from the skin starts to become scaly, and those scaly skin cells plug up the little hair follicle and result in the keratosis pilaris bump becoming more noticeable and more problematic. In the description box below, I will list some very gentle non-soap cleansers that are oil-based and are a better option than a bar soap or a liquid soap such as Dial, for example. Those are things that you want to avoid because they're really going to dry out your skin and leave the skin barrier parched and impaired and just really drive the keratosis pilaris. The second thing that you should be really embracing and making a part of your everyday life as much as, say, brushing your teeth is moisturizing your body with aggressive focus on the areas that are affected by keratosis pilaris. Last week's video, I talked about some tips about moisturizing the body that I will list that video in the description box. Make sure you check it out. But one of the most important things for you to understand about body moisturizing that will help this skin condition is that when you bathe, after you get out of the shower, the best time to put on moisturizer is immediately to wet skin so that it seals in that moisture into the skin and slows down the transepidermal water loss, okay? Again, I will list the moisturizing creams that are fantastic for this down in the description box below. So that's some general bathing advice that will help your keratosis pilaris and how to moisturize around bathing. But in between bathing, one way to approach moisturizing the areas of the body that are affected by keratosis pilaris is to select a light lotion that contains a little bit of what is called a keratolytic. A keratolytic is an ingredient that helps to break up the skin cells, okay? And if you'll remember back to the beginning of the video where I talked about how keratosis pilaris is an accumulation of skin cells around the follicle resulting in a plug, you can imagine how a keratolytic that dissolves those skin cells and separates them is useful, okay? And if you'll also remember, I said that in keratosis pilaris, there is an inefficient turnover of those skin cells within the hair follicle, so they're retained and they're not exfoliated. And they're not properly exfoliated. Using a keratolytic can help break that up and allow those skin cells to lift off the skin, okay? So what are types of ingredients that are keratolytics? Well, one such ingredient is salicylic acid. I will list down below some salicylic acid containing creams that are helpful for this skin condition on the body, not on the face, just the areas on the body that have this problem. Now, I will talk about some tips for keratosis pilaris skincare on the face in a minute, but another ingredient to look for in a body moisturizer that is a keratolytic is something called alpha hydroxy acid. It too can help break up some of the skin cells there. Alpha hydroxy acids include things like glycolic acid, lactic acid, mandelic acid. There are many wonderful lotions that contain a gentle and effective amount of alpha hydroxy acid for this skin problem that I will list down below. Many of those also contain good moisturizing ingredients, so they're great for keratosis pilaris on the body. But as far as skincare for keratosis pilaris on the face, one approach is to use a keratolytic in a wash form, such as a salicylic acid acne wash, really targeting the areas that are most plagued by the keratosis pilaris, okay? A 2% salicylic acid acne face wash is one such example. I will list some down below in the description box. There are also some glycolic acid-based washes and alpha hydroxy acid-based washes that are helpful for this problem that can help to turn over those skin cells a little bit more readily. Do understand that these face washes are effective keratolytics with just a short contact time to the affected area, so you don't need to leave them on the face for a long period of time. You don't need to put them in areas that are not affected by this skin condition. Just focus a little bit of lather in the areas that are affected. Allow it to sit on the skin for a few seconds and then rinse it off. Make sure you avoid using these washes around your eyes, as they will cause quite a bit of irritation in those areas, okay? So that's something that you need to understand about the keratolytic based washes for the skin problem. The other thing that you need to understand about these keratolytic based skin washes for the face is that as they are lightly exfoliating the top layer of your skin, they do predispose you to both a little bit more dryness and peeling, particularly in the beginning if you have never used one, as well as a little bit more allowance for sun to come into your skin, okay? So what does that mean for you? It means two things. After you wash your face with one of these such washes, you need to make sure that you apply a moisturizer and a moisturizing sunscreen at that, okay? If you're going out during the day. I will list some fantastic ones down below in the description box, but by applying a moisturizing sunscreen immediately after you have rinsed the face and gently towel dried it, this can also this will cut down on both transepidermal water loss, keeping the skin hydrated, as well as to protect your skin from the sun. Those are both very important points. Now, as far as scrubs and exfoliants for keratosis pilaris, I always encourage everyone to resist the temptation to aggressively scrub the face and to scrub the body, okay, with either a loofah or a harsh facial brush or anything like that, because while this can help to gently dislodge some of those cells, it also irritates the neighboring skin quite a bit, and as a result can increase the dryness of your skin. And when the skin becomes more dry, it becomes more predisposed to worsening keratosis pilaris. So back off on aggressive scrubbing the face. No salt scrubs, no facial brushes, nothing like that. However, areas on the body and some areas of the face, it is okay to use just a normal washcloth and just do a few light circles in those areas. Nothing too hard or too scrubby or anything like that. That will help to gently lift up those plugged up little mounds of skin cells that are causing the bumps. Many people ask me about getting a chemical peel for this skin problem, particularly on the face. And I do think that chemical peels, such as a salicylic acid-based peel in an office setting, can actually improve the appearance of keratosis pilaris quite a bit and can be helpful. Do know, however, that it's only going to be transient, as I mentioned in the beginning. Keratosis pilaris is a chronic skin condition. There is no cure. So while a chemical peel will improve the appearance of it, do know that it's something that you would have to maintain on an ongoing basis. And so a more affordable and probably likely option for you is to have a skincare routine that contains a little bit of a gentle amount of these acids, so that you're doing a little bit each day rather than having to invest both your time and financial resources into a bigger sit-down chemical peel. You're just doing a little bit every day to stay on top of things. Kind of like wiping down your countertops at the end of the night keeps your house clean, versus, you know, waiting for everything to get messy and then paying somebody to do a deep clean. Think of it that way, okay? Just do a little bit each day with a gentle approach to keep maintenance going. That way, you know, a big in-office based thing may not be as necessary and less of a strain on you financially. One of the things about keratosis pilaris is that it can become rather inflamed, and the redness can become quite noticeable. And that oftentimes is one of the things that's most bothersome to people, is not only the rough and bumpy stuff, but the red stuff, okay? And sometimes you've removed the rough and bumpy stuff, but the red stuff still stays behind and is difficult to get rid of. So people often ask me, is there anything that I can do for that? Is there a cream? No, there's not a cream, unfortunately, that will take that away. But there is an in-office based laser procedure called a pulse dye laser or vascular laser, okay, that can be helpful for reducing the redness of this skin condition. So that is an option that can be helpful, is a vascular laser. It can improve the appearance quite a bit because it is a cosmetic procedure and is not covered by insurance. Additionally, there are some reports that laser hair removal in the affected areas can also improve the skin condition, believe it or not. You know, say you're somebody who has keratosis pilaris on the upper thighs. You also are, you know, bothered by the hair there, and it's dark hair, it's hair that you're shaving. Shaving can actually worsen keratosis pilaris, by the way, because it disrupts the skin barrier, makes the skin drier, and then as the skin becomes drier, the KP flares. So that is a situation where laser hair removal can both remove the hair effectively, getting rid of the need to shave, as well as help the keratosis pilaris a little bit in terms of the appearance. So that is another cosmetic procedure that would be worthwhile pursuing, okay? So these tips are sort of specific to keratosis pilaris, but for people with keratosis pilaris, it's important to understand that dry skincare and understanding dry skin is kind of a cornerstone to really thinking about your disease and how to manage it and be an advocate for yourself. So I encourage you to check out last week's video if you missed it on my dry skin Q&A, because I give some more tips there that are for a broader audience that will also be helpful to you. But I really hope this video was helpful. My hope is that if you're suffering from this condition, that these tips can help you this winter, help keep the flares at bay so that you can focus on, if you're in school, you can focus on your studies, and not feel like you can't spend time with your friends, not be embarrassed. Enjoy all those social activities, enjoy the holidays with your family, and not worry about pictures coming up, all of those stressful things. I hope that these tips kind of prepare you as far as how to start taking care of your skin to make these things a little bit easier on you. And you're not alone with this skin condition. If you feel that your self-esteem is impacted, that you're isolating yourself, please, I encourage you to seek out betterhelp.com. I really think it's a helpful resource. So yeah, I'm going to conclude the Q&A this week. I hope you guys enjoyed it. Give this video a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys in my next Q&A. Bye!